It turns out when there's a small lesion in one part of the brain, what you get is not an across-the-board reduction of all your mental capacity, a sort of blunting of your mental functions. What you see is a highly selective loss of one specific function, such as recognizing faces or reading, the other functions being preserved intact. So this gives you some confidence in saying that that region is somehow specialized for that function. You can then home in on the microcircuitry in that region, see what it's connected to, and understand the functional logic, and map function onto structure. So that's the goal of the whole enterprise. So what we do is we look at patients who have sustained injury, look at how their behavior, how their mind has changed, and ask ourselves, what can this tell you about the functions of the normal brain? That's one agenda. And then there's a clinical agenda of trying to help the patient. And sometimes we succeed, sometimes we don't. One example of this is Capgras delusion. The person says, this woman looks just like my mother, doctor, but she's an imposter. She's some other woman pretending to be my mother. So there's a strong emotional component to it. Sometimes acquires a little paranoid flavor. Why is this woman following me all the time? She's not my mother. She looks like my mother, but she's not. Why is she pretending to be my mother? Okay. So what causes this? What we think is going on here is the visual pathways are normal. Fusiform gyrus is normal. That's why he can recognize his mother and say, it looks like my mother. But the wire that goes from there to the amygdala is cut by the accident. Therefore, he looks at his mother and there's no emotional arousal. So there's no warmth when he looks at his mother, or no fear when he looks at his mother. It seems bizarre to you and me, but given the disconnection in his brain between vision and emotion, vision is normal, emotion is normal, but the two are uncoupled. Only sensible interpretation is this very bizarre interpretation that she's an imposter. But if you come up with an anatomical explanation, you solve the mystery. You do Sherlock Holmes-like deduction here, and then you analyze what's going on, and its mystery is solved, and you can test it experimentally using a very simple procedure. Another even more bizarre disorder, if you can believe it, is Cotard's disorder, where a person says, I am not alive, I am dead. I'm a rotting, dead body. I've been buried. My corpse, I can smell my stinking corpse. Now, why does Cotard occur? We don't know. But there's a representation of self, just like there's a representation of other people in your brain. And when there's an alienation of the self, because of some kind of disconnection going on in the brain, that may contribute to Cotard syndrome. But also, just as in Capgras syndrome, there's a disconnection between visual sensory signals in the amygdala and limbic structures, so that your mother fails to evoke emotion. Imagine a much more widespread disconnection of all sensory input. Hearing, touch, vision, everything is disconnected from the limbic structures. There's an impoverished sense of self, an alienation of self. None of the sensations in the external world have any emotional significance. That's about as close as you can get to existential annihilation.